Good day. I'm the Reverend Charles M. Taylor, Senior Minister of the Universal Truth Center for Better Living. I am pleased to have with me today Dr. Audrey Dawson. She's a psychologist and founder of VIP Transformations. So, Audrey, welcome. Dr. Audrey, welcome.
Thank you. Thanks for having me.
You're welcome. Thank you for taking time out of your day to share with us and just have a brief conversation about the COVID-19 and its impact on our mental and emotional health. So before we get started, just tell us a little bit about yourself and your background.
I'm a clinical psychologist, and since about 1994, I was a social worker previously, and I worked specifically with, I began my career working with children who were impacted by the AIDS epidemic.
Okay.
So this COVID-19 kind of bears some resemblance to those times when we didn't have a lot of answers.
Right.
And the amount of emotional distress a lot of people were under. Of course, foster care was my area at the time, which is a little bit more intense. But again, we still didn't have a lot of answers as we were dealing with children who were impacted, either their parents being ill or they themselves becoming ill with the disease.
Okay.
And then throughout the rest of my career, I worked with the elderly, and I've also worked with teens. So I have a large range of people that I've worked with.
Okay, thank you. So you basically deal with family dynamics.
Absolutely, yeah.
Family dynamics, great. So share with us briefly how this current pandemic is affecting the family. How is it affecting the families?
Well, number one, because we don't have a lot of information on what we should be doing, and there's a lot of misinformation going around. And as we learn more and more about this disorder and what to do, people are really making their moves off of fear,
Okay.
So you see some panic. And then we also have those who are dealing directly, if they're indirectly impacted from family members or directly impacted being that they're ill themselves. Those people are also going through a different level of stress, and we can look as we see this, how it pans out, depending on the level of connection that people have to the actual disease. You can see some PTSD, you see the depression and the anxiety. And now being at home in quarantine, we're starting to see even more distressing symptoms, because if they have other mental health illnesses that were underlying prior to this, there's even more distress.
Okay.
So,
all right.
Yeah, so go ahead.
Yeah. What are some of the signs of what are some signs of stress, the stressors? What are some of the signs of that?
Well, number one, there's a lot of the stresses you're going to see is anxiety.
Okay.
So with anxiety, you're going to see like worry, feeling very anxious. You're going to see, behaviors that you just don't know, like you're not feeling like you're in control.
Right.
So those are some of the things. And with children, you might start to see acting out behaviors where they're not doing their schoolwork, disinterested, easily distracted, regression in behaviors like bedwetting or, acting more baby-like at home. So if parents are paying attention to some of those things, it'll be an indication that they're having some stress.
Gotcha. So what can families do to support, say, their children? Let's talk about the children for right now. What can parents do to support their children to move through this time in a healthy way?
Well, number one, I want to say is limit the amount of time watching news or watching things that are based around this whole pandemic,
Mm.
limit TV viewing to let the adults watch the TV in regards to that and provide the information to the children. So you definitely want to know and be updated what's happening, what's new, because we don't know a lot of information, and
Right.
today something can change as to how we need to behave. I remember one time we weren't supposed to wear masks and now we have to wear masks. So we want to be updated. We want to have the right information, but also you want to talk to your children about what the right thing is in the moment. Right. We want them to be clear, because if they have an understanding of what, is actually happening, then
Mm-hmm.
they feel a little bit more at ease, because then they
Gotcha.
know exactly what they can be expecting. And,
Gotcha.
provide support, answer questions, and give them an opportunity to also, do things that are fun.
Yeah.
So it shouldn't just be, learning whatever it is they're learning in school. And I know a lot of parents are already having problems with, trying to
Correct.
homeschool their children, but
Right.
also making sure that they have play dates on Zoom or some other, this type of platform.
Right.
uh, they play games, or, they just have some access to speak to their friends, their school friends, and to kind of organize that for them so that they can have those connections. Um,
Mm-hmm.
I also think a good idea with children is how we model our behavior.
Mm-hmm.
So if we're emotional and anxious about this whole pandemic, and that's what we're expressing in the home, the children are watching us.
Right.
This is where they learn how to deal with their emotions, is at home from their parents. So if
Correct.
you're modeling a behavior that shows that you're calm, you're cool, and you know that things are going to be okay, your children
Mm-hmm.
will feel more at ease as well.
Gotcha. Gotcha. So, what are some things that we as adults can do to better maintain our emotional and mental health during this time?
Again, some of the same things. You
Okay.
definitely want to limit the amount of access that you're having to news in relation to, especially with things that you don't control. You don't
Mm-hmm.
control the amount of deaths. You don't control a lot of the things that are happening out there. So you don't have to know every little detail about what's happening during the pandemic, because sometimes that's just elevating your stress levels.
Right.
So
Right.
limit it to what you really need to know and what you need to do. And when it comes to what else parents can do? Well, definitely you want to continue to have good social contact. Use the same platform so that you have connection with your loved ones. You know,
Right.
keep in touch with family members. I think they recommend something like reaching out to about 5 people per day, just
Mm-hmm.
to have that connection and check on, especially those who are more isolated, like our elderly. The
Right.
elder, elder members of our families, because
Right.
often they have been at home anyway. They've
Right.
prior to this whole thing, they've been at home by themselves, and
Yes.
at this point, they really need to have those connections, because they can't go out anymore. You know,
Right.
it's,
Right.
they shouldn't be going out
Mm-hmm.
as often. And so we want to make sure to be checking on them, and we're, keeping those connections. I think
To
that's
reach out.
an important part of
Yes.
it. Yeah.
Right.
Exercise, another good thing. We can all, I
Yes.
think Dr.
Yes.
mentioned that during the town meeting. I meant to mention that as well. So exercising daily, having a routine, and even for the children as well, maintaining them kind of like when they were in school. They should be getting up, brushing their teeth, going through the same motions they would, and then going on,
Right.
online to go to school. And you get up every morning. Hopefully, we still have some people employed, but even if you're not, to get up and still have a routine where you're getting up, you're going online, you're looking for work, or whatever it is that you need to do, so that you also are not idle at home, because that's
Correct.
has some anxiety, also sleeping, or depression for that
Yeah.
matter.
Yeah. I was going to ask you about maintaining a routine, like getting up, uh, doing your hygiene,
Absolutely.
getting dressed,
Yeah.
coming out of your pajamas, and so forth. How important is that?
It's very important, because it's not just a psychological, it's also a physical thing that you're doing, the two combined. It's
Right.
so important to keep your body kind of moving and your mindset moving, and that you have something to do every day. Because when
Mm-hmm.
you don't have something that you're doing every day, it leaves your mind time to wander, and you
Right.
feel distracted, and you feel more chaotic
Correct.
without those routines in place.
Okay, okay. And I don't know if you could address this, but you know, we've heard so many myths about this virus, especially affecting the Black community.
Mhm. Yes,
You want to share some of those and the impact it has had on us?
absolutely. In the beginning, yes, we were hearing way more about other people getting it. It was a focus first on, it coming out of China and then, in Europe, and it was such a big deal. And then coming over here, we weren't hearing about Black communities being impacted, but it
Yes.
doesn't mean that we weren't. The problem is that the data wasn't available. They didn't have the data available for us.
Hmm.
And a lot of that too is based off the disparaging, differences in healthcare that people in our communities receive in, relation to, the majority population. You know?
Hmm.
And a lot of that is not just based off race, also economics. So marginalized people, whether it's by race and or economics, don't receive the same type of care, health care,
Hmm.
unfortunately.
Hmm.
So that was one of the big things. And then once we realized, oh yes, we are indeed highly impacted by this virus. Well, it's not something we really should be surprised about, because again, we often in these more marginalized communities, people of color and people who are poor, we
Hmm.
don't have access to, we tend to have more comorbid disorders, right? So we'll
Okay.
have hypertension, we'll have diabetes. And when you have those other health issues, you're more
Right.
susceptible to not faring well if you become ill with COVID-19. It makes your ability to deal and fight that off a little bit more difficult than somebody who is healthy.
Hmm. So you mentioned physical exercise earlier, and which is very important for us to do during this time. What about healthy eating during this time?
Oh,
How does that? How would that affect your emotions? Because a lot of us may be engaging now in a lot of emotional eating.
absolutely.
So you want to talk about that a little bit?
Yes, it's same thing with keeping that routine. We want to pay attention to what we're consuming, because you really are what you eat, and you
Yes.
will feel like, when you're eating really healthy, you tend to feel good. You feel better emotionally,
Yes.
and when you eat things you're not supposed to eat, you feel guilt.
Tell me about it.
It feels good in the moment, but then you feel guilt, which leads to more depression and can lead to more, cycling of that, poor eating habits. So when you start
Right.
to have a routine where this will be a really good time to start saying, you know what, I'm going to try some new ways of eating healthier foods. I'm
Gotcha.
going to get out to get live foods, greens, and find ways to incorporate things that are higher minerals. Was another thing about this virus is that you want to have that the healthiest immune system, right?
Gotcha.
So that you can be able to fight something, right?
Right. Right.
Or your other illnesses, if you have hypertension, high cholesterol, anything else, we all know that if you're eating better, you tend to have less issues, as well as exercise.
Correct.
Have less health issues. And if you're incorporating those two things, you're gonna feel better. And it's a
Right.
great way to start fighting off, possibilities of being exposed.
Correct. Correct. Are there any resources or organizations that we can reach out to talk to somebody or to maintain a healthy emotional state?
Um, Well, there definitely are. So I'm in Broward County, so I'm more aware of the things available in Broward County. So for mental health concerns, 211 is, if you're having issues and you have anybody in your home that's feeling like suicidal or feeling like they want to hurt themselves,
Hmm.
211 not only offers you the resources in your area, they
Right.
also have people who can talk to you in the moment. and can assess whether or not they need to send out a mobile crisis unit to you at that moment. And I know that Miami has one. I want to say it's 311, but I don't want to swear by it yet.
I believe it is 311. Yes.
311, yes. So they offer the same exact services. And then they can also get you in contact with different mental health providers in your community where you live based off your zip code.
Gotcha. Thank you. But to wrap this up, is there anything you want to, last thing you want to share with the audience that could really help them to stay grounded during this time?
Well, you know, one of the things when I start therapy with anyone, I always talk to them about how they're feeling. And I always describe these two things. If you're depressed, it's most likely that you're thinking about things in the past, right? That you can't change.
Yes.
So if you can't change what happened in the past, and this is what you're trying to do because you're constantly thinking about it, it's not beneficial.
Mm-hmm.
And when you feel anxiety because you're looking at the future and worrying about things that have not happened yet.
Okay.
So, those are like important things to think about. I also try to assess whether or not someone, it's not really so much based off religion, but off a spiritual concept of, if you believe in a higher being,
yes,
and then you understand your own divinity, the divinity of humans as children of God, right? Then that also gives you a sense of control and brings up your level of understanding of your own power.
Yes.
And then thinking about how you think, because your thoughts are what carry, our heaviest burdens are the ones we carry in our heads.
Amen.
Amen. So if we can think better thoughts, right, and we think about things in a way, then we can put those things into motion. They become, our thoughts become our words, and then our words become our actions, and then we receive the reaction that we want. And I always try to incorporate that into my therapeutic process because I think, and I know that's part of the 5 principles, right?
Yes.
Line. So when you have those 5 basic principles, I mean, it's something that's definitely going to empower you to understand that you really do control your destiny.
Good stuff. Yes. Okay. Very good. All right, Dr. Audrey Dawson, I want to say thank you very much for spending time with us today. And we pray and that this will be a blessing to those who watch and hear this. And may your family be blessed. And thank you for all the work you're doing in the community.
Thank you. Thank you for you're most welcome. I am very grateful and thankful, which is another thing I like to point out, is being grateful and thankful does definitely do a lot for your day and for your own emotions. So I appreciate your time. I appreciate everything you do for me. I need you every Sunday. I need your prayer meetings. So definitely, I want to thank you as well. And I'm honored.
All right.
Thank you.
Peace and blessings to you and your husband and your family. All right. Have a good day.